It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
All right, back with our first guest, Dr. Eric Peng, orthopedic surgeon specializing in hand, wrist, and elbow disorders, UCL injuries of the thumb, something what Drew Brees had. What is this?
Ulnar, that's good. That's good so far. Ulnar Collateral Ligament injury of the thumb. Drew Brees, yes, sometimes called gamekeeper's or skier's thumb. It's when you overstretch the base of your thumb joint and you sustain an injury there.
All right, here's Dr. Peng and Shannon O'Kelley.
Dr. Eric Peng, welcome to Health Talk. How are you?
I'm good. Thanks for having me.
Well, thanks for joining us. Tell our listeners about your practice, your interests. Obviously, you're an orthopedic surgeon with an interest in hand therapy, but I always like to find out about your training and how you got interested in the hand, because that's a complex area of the body.
Yeah, absolutely. I'm originally from California, and that's where most of my education was. I did my orthopedic residency at Stanford, and then I most recently did my hand fellowship in upper extremity surgery and microsurgery at Duke University in Durham, North Carolina. So I've lived kind of all over the place, but now I'm back up here in Seattle, and I had a great opportunity to join the group that I joined. It's Orthopedic Physician Associates. We have a couple of offices, but our main office is downtown, in First Hill, but we have offices in West Seattle and Issaquah, and we're kind of one of the bigger orthopedic providers in Seattle. We have 28 providers, I think, in all different subspecialties, so we got everything.
And when you talk about subspecialties, I think that's important to our listeners. Everybody coming out of orthopedic residency, all orthopedic surgeons, pretty much 99% of them are doing fellowships, and that's that 1 year extended kind of a program that you just specialize in surgery of the elbow down. Is that fair to say?
Yeah, that's correct. There's other areas that you can specialize in: total joint replacements of hips, knees, elbows, shoulders, arthroscopy, so sports-related injuries, spine. We have some non-operative providers as well who provide injections and things like that. So we have pretty much everything covered nowadays.
Pretty fascinating to be in medicine in today's world with the technology advancements and just the training. To spend 1 year at Duke just doing upper extremity elbow down type surgery. You're essentially you're an expert. That's kind of what your wheelhouse is.
Yeah, I would definitely say that's kind of what I strive to be an expert in, for sure. I've definitely had a great opportunity to learn from some of the best and the brightest in the field at both Stanford and at Duke. So, I'm very fortunate and grateful to have been able to train at those places.
Well, let me ask you, why the hand? Going through orthopedic residency, you could have gone hip and knee, you could have gone sports. Why the hand? It's a complex area. I mean, it's a difficult area sometimes to treat.
Absolutely.
And it's so important to us to live.
Yeah, no, I think so. Your hand is pretty, critical in pretty much everything you do, I would say, for the most part. My interest with it was a few fold, I would say. It's relatively smaller cases. It's a faster paced subspecialty in terms of you can do 10 kind of 15 to 20 minute procedures rather than doing 1 10-hour surgery. The anatomy also is very elegant, as I'm sure you know.
Yeah.
And I find that to be really interesting. And there's a lot of variety as well within hand surgery itself, which I really enjoy.
Well, it's a very detailed area, obviously. I mean, you have to have a lot of knowledge and a lot of expertise just because there's a lot of problems that can happen in the hand. We're going to talk about one of those problems, and that's the ulnar collateral ligament. And let's go back maybe 10 weeks ago. Pretty famous quarterback by the name of Drew Brees, New Orleans Saints, sustained this ulnar collateral ligament injury of his thumb. He was out. They did surgery on him. Let's talk about that and kind of what do you think happened? What kind of surgery was performed? How did he come back? He essentially, I think, came back in 8 weeks. Pretty impressive.
Yeah.
Tell us about the ulnar collateral ligament in the hand.
Yeah. So in general, for those of the listeners that aren't familiar, ligaments kind of attach bones to other bones, and they serve to stabilize joints in general against kind of unnatural forces. This is hard to describe over the radio, I guess, but if you look at your thumb, the way it kind of bends forward or up and down, rather, it doesn't go side to side very much, especially at the joints. And that's what the ulnar collateral ligament stabilizes. I don't know if I saw his injury exactly, but generally how that happens is it kind of bends your thumb in an abnormal direction and puts stress on that ligament. Ligament injuries in general, they kind of come in 3 flavors, grade 1, 2, and 3, 1 being partial, 1 being kind of a stretch type of injury, 2 being partial, and 3 being a complete injury. His injury was a complete injury, it sounds like. And when you have that, those are generally surgically repaired, especially in high-level athletes.
Just like the knee, when we describe the ligaments of the knee, we describe the medial and lateral collateral ligaments. So the thumb joint, that base of the thumb joint, I've always called it the saddle joint, has those ligaments on the inside, outside, medial and lateral. The joint got torqued or stressed, that lateral ligament most likely, or tore. That's kind of what happened in Drew Brees.
Yes, that's exactly what happened.
More with Dr. Pang coming up right after this timeout on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
We continue our conversation with Dr. Eric Pang and Shannon O'Kelley.
Dr. Pang, again, thank you so much for joining us, and thank you for the description you just provided on the ulnar collateral ligament injury of the thumb that Drew Brees sustained. A lot of times in other sports, we sometimes will call this a skier's thumb or a gamekeeper's thumb. It's a movement or a stress on the thumb. It tears that lateral ligament, and you're going to get called in to diagnose this and then ultimately maybe repair it or put it in some kind of a splint. Tell us about that process.
So diagnosis in general is, a combination of history and physical exam and sometimes imaging. For this, the type of injury is important, but the exam is important also. Typically, you have a little bit of laxity in the thumb, and you always want to compare it to the other side because everybody's a little bit different. But the kind of general guidelines is if you have, more than 30 or 35 degrees of laxity against the ulnar collateral ligament, or more than 15 degrees compared to the other side. Sometimes this is obvious, like their thumb is falling off their hand, but most of the time it's kind of a more subtle type of finding, and those can be more difficult. If there's any question in general, I would get an MRI, which is the kind of best modality for looking at soft tissue injuries. And I believe that's what Drew Brees had and what most athletes will end up getting. If it ends up confirming a complete tear, again, we're a little bit more aggressive in fixing these in high-level athletes when you're trying to get them back on the field. And that's what Drew Brees had as well. Typically, in the past, it's been a repair, either from where the ligament pulls off of the bone or if it tears in the middle. But recently, probably in the last 5 to 10 years, I think, we've been using what's called an internal brace, and that's what Drew Brees had. And that was, I think they showed an animation of it on either Monday Night Football or Sunday Night Football. But what it is, it's this kind of braided, non-absorbable, kind of very strong suture that we lay over the top of the ligament in the same orientation. And the idea is that it protects the ligament as it's healing so that you can rehab them faster. Without it, if you were just to do a repair, either with suture anchors back to the bone or in the substance of the ligament itself, that's probably some version of 4 weeks in a cast or splint and then 4 weeks in something removable with the hopes of starting rehab, in the middle there and getting them back on the field around 7 or 8 weeks. With the internal brace, in theory at least, you can get them rehabbing at maybe 2 or 3 weeks and getting them out on the field at 5 or 6 weeks. So that speeds up their recovery process, and that's really important, especially when you have a lot on the line.
Yeah, so that's an interesting description. Thank you so much. I mean, this internal brace, so they're going to repair the underlying ligament damage, and then they're going to put this brace around it or over that repair, and that brace essentially supports that as that repair is healing, so you can get more aggressive. You have additional support. Correct.
So the theory is that any or excessive force that ligament might be seeing while it's healing gets protected by that brace.
Yeah, in my opinion, he came back pretty quick, and he's doing really well. So that was a pretty good repair and pretty good results. Is that typical with these repairs?
Yes, I'd say getting back to sports after these types of injuries is a very high rate. With the brace, you get back kind of in that 5 to 6 week period. Without the brace, probably a little bit longer. Also depends on what you're doing, obviously, and will take people a little bit slower if their jobs are, it's not as important to them.
Dr. Pang, again, thank you so much for your time and information, and welcome to Seattle. And let's have you back and talk about some other hand injuries, okay?
Yeah, absolutely. Would love to. Thanks again for having me.
All right, you've been listening to Dr. Eric Pang, orthopedic surgeon specializing in hand, wrist, and elbow disorders from Orthopedic Physicians Associates, opaortho.com to get more information. And, the thumb is something, if you're not careful, kind of like the big toe. You don't realize how important it is to the hand.
Oh, just ask Jack Horner. I mean, all you got to do is just remember to ask Jack Horner how important the thumb was.
Pull out a plum with his thumb. That's right.
Exactly.
All right, our next guest coming up right after this time out on Como.